the process for me of actually growing from the event really did involve, can I help other people through this? And I don't mean, on a one-to-one basis, of course that would be amazing, and I totally felt like I would reach out to anybody, and I did. Anybody that, looked like they needed it, if I had any knowledge that they might need a reach out. But I really wanted to do something on a bigger scale. I felt that we should be reaching out to each other individually, but that the institution should stand for reaching out, that we should wrap around people as a whole institution when they're vulnerable. For us to be as good of clinician as we can be, to be really empathic. If I walk into the room and really want to be there for my patient through thick and thin, whatever they're feeling, whatever they have to go through, I've got to be a whole person before I can walk into that room. I have to have a sense of integrity. I have to have a sense of peace, of wholeness. And if I don't, then I can't give as good a care. I just can't. Nobody can. And I wanted to be part of an institutional change movement that would focus on what can we do to support each other. And I thought, one of the things where there's a screaming need is, let's at least, or start with supporting people, clinicians at their most vulnerable, at their most, at the point where they really feel like things are falling apart for them, or even just at the point where they need it. And I think an adverse event is one of those obvious points.